Welcome back to our series on physician well-being. In part one, we delved into the personal and professional challenges faced by family medicine physicians, highlighting the high burnout rates within the specialty. Today, we continue our exploration with more firsthand perspectives from physicians who were attending the Society of Teachers of Family Medicine annual conference in May 2024. This episode features person-on-the-street style interviews with physicians who are deeply engaged in clinical practice, research, and education. They share their insights on the current challenges and the most critical steps healthcare systems can take to improve professional well-being. Listener note, these interviews were conducted at the conference, so some background noise may be present. Let's now dive into part two and hear from more voices who are both on the front lines of clinical care and also tackling the challenges of physician well-being head-on. There are times in our lives that change the way we see the world. Navigating these challenges can take insight, trusted confidants, or even a coach. Let's explore those moments. In this companion podcast to RX for Success, we will discover ways to learn and write our own success stories together. I'm Dr. Dale Waxman, a physician coach with MD Coaches, and this is Life-Changing Moments. I spoke with Dr. Bridget Lynch, the director of the American Academy of Family Physicians Resident Wellbeing and Burnout Project ECHO, and in clinical practice in Santa Fe, New Mexico, and Dr. Aisa Steiner, the director of the Family Medicine Resident Wellbeing Program at the University of New Mexico School of Medicine and in clinical practice in Albuquerque, New Mexico. Their presentation was on the use of Project ECHO across family medicine residents across the country. So what we have here are two people who have not only been thinking, first of all, in the trenches, practicing, teaching, and also recognize early on the need for some work around professional well-being. So I've been doing some thinking about this and leading around it and hearing other people's stories around it. And I realized the question I'm about to ask is a big question, but I just want you to just sort of reflect what's the first kind of two or three things that come to mind. But the question is what should healthcare systems, practices, organizations, and leaders, what should they most pay attention to so that we improve healthcare professional well-being? Aisa?
Yeah, that was a big question. I mean, I think if you are speaking very broadly about a healthcare system, that we should be supporting primary care and the complexity of work that we do at a higher reimbursement rate, some other way to support us, and that could be more pay, more recognition, feeling valued, but at the same time being supported to do primary care. Primary care is super hard. We all know that. And if you can support people to do that work correctly, then you reduce moral injury and you do reduce risk of burnout. And by having support, I mean a full team that can support the needs of individuals that we care for. That's assisting with in-basket work, that's assisting with social determinants of health for our patients. So that's like a lot of things to work on, but that would be my consensus.
Yeah. So I just want to, can I go a little bit, just a follow-up question with respect that the audience here may not know a whole lot about family medicine or primary care, for instance. So can you say just a little bit more about what makes it difficult to do primary care? You said we all know that it's really hard. Well, the three of us know because we're all primary care physicians. But what makes it hard on a day-to-day basis? What are some of the real significant pain points for you?
So a typical day for family medicine, we'll just say outpatient for now, in a clinic is that maybe you have a schedule full of patients that need a lot of attention, need a lot of support and guidance to find optimal health outcomes, and they're maybe scheduled every 15 minutes. So you have 15 minutes to figure out maybe a new complaint that a patient has or manage a chronic disease that may not be controlled like diabetes. And it's not just one thing that you're dealing with at that session or the visit, it's multiple parts of that patient, and maybe their diabetes isn't controlled because they can't afford their medications or they don't have insurance or some other challenge. And so in addition to figuring out why they came in with a cough and why and how to support their diabetes and the trauma that they've had and all these other resources, and then 15 minutes goes, you still haven't finished your note. There are a million other people asking you for help, maybe your nurse, maybe your medical assistant, on what to do, and then you have to go into the next patient room and do the same thing. And as the day progresses, you're more and more behind, and then you get back to your desk at some point. Maybe you haven't even eaten, and then you're supposed to respond to all the messages that patients have sent or that your staff has sent and figure out what's happening with the other patients that you didn't even see today.
That's one of the most succinct and excellent descriptions of what it's like to be a primary care physician. So well done. And what I heard you say is what needs to happen is some support for you to be able to carry out the functions that would be most helpful for patients. It's not just a matter of extra time with the patients, but it's also, how do I resolve this issue this person can't afford? We're not trained in medical school how to deal with that. That's not really our job, but we have to pay attention to it because we just do. So thank you for that. That's awesome. Mm-hmm. So, Bridget, you've had a little bit of time to think about your response to the same question. Mm-hmm. What are your thoughts?
So my take on this concept of wellness, well-being, and burnout is that, again, we are asked to do so much. We are capable of doing so much. We are so well trained to be able to do so much for our patients, ourselves, our colleagues, the healthcare system, and allowing us to use all of our training in our clinical day, I think, is going to be critical to maintaining our workforce that we have now and attracting future primary care physicians, making it a place where physicians truly are having autonomy to see things that they know need to be improved, come up with solutions, work with their teams, be leaders of the team, and creating a milieu that allows for creativity and sustainably.
What's getting in the way of all of that right now?
I haven't quite figured it all out.
Okay.
But I do know for myself and my colleagues, something that's really resonated is having a patient leave the exam room without getting what you knew they needed, whether it be because of limits of time or limits of resources, is the thing that erodes us over time and makes it harder to work at your best with your greatest of energy and harnessing, that human potential that we all have, that our patients have, being able to work at that highest level, and also allowing our staff to work at their highest level and allowing physicians to lead that, what that looks like, what we're needing, I think will be incredibly important for all the outcomes we're looking for.
Yeah. I'm going to ask this to both of you, if you had a magic wand and you were able to create the situation that you wanted, what would that look like?
Yeah, I think personally allowing each individual physician to be the leader of their micro team that they're working. I mean, so often now medical groups, maybe the physicians are separate from the staff being led by clinic management and not by the physician. And so I think that disconnect truly doesn't allow the physicians to lead at the level that we're able to.
Aisha, do you have a response to that? You're still dreaming over there.
Yeah, universal health care.
Yeah, there's a lot. I mean, I realize it's a big ask, right? So
I would say probably just to make sure, like an institutional level, that there is adequate staffing.
Very good. Dr. Rebecca Seekamp is a family physician at Stanford University. She did a poster presentation with Dr. Daniel Dodek, also a family physician from Vancouver, Canada, on factors contributing to burnout in both the U.S. and Canada, and compared the results across both countries. So, Rebecca, thank you for being here and allowing me to just to ask a few questions about where, some of your thinking. What do you think should be done in healthcare systems, practices, and hospitals, et cetera, all the places that healthcare professionals work, that would improve well-being and reduce burnout?
Yes, that's a big question, and I'm so glad people are talking about it. I think Stanford's known as a national leader, as a place where physician wellness is taken, as very important, that we have a whole wellness program, and there's a lot of things that protect our wellness, and I'm very grateful for all the benefits I've had from that program. But I also am pragmatic. I have a lot of friends who are not in leadership or just clinicians at Stanford who say that, there's another side to that there's burnout and there's politics, and there's a lot of things that aren't reflected in the wellness name and shiny lights that we have when people think of Stanford. And so I'm at the end of the day, I really care about good doctors and doctors anywhere, not just at Stanford, really getting seen and heard for what they're going through, because they're leaving in droves.
And you did a poster presentation
Yes.
here around this topic. Can you
Yes.
tell us a little bit about what
I'd love to talk about my poster.
Yeah, what did you learn?
So first of all, what my project is that I really wanted to go to Canada to see what they're doing up there. I've always idealized their national healthcare, as many Americans and maybe many American physicians do. It's like, gosh, they can imagine one of our biggest moral injuries, I think I can speak for many of us, is patients who can't afford their care, the discrepancies, the social determinants of health, all the things that are not fair to patients who don't have the financial means to get the care they need. And some of us idealize that in a place with national health care, they wouldn't have these same problems. And so I wanted to look at what that looked like, what it would be like to practice medicine in Canada. And then in parallel to that was my concerns about burnout and, my colleagues burning out, and how can wellness protect us? Wellness is not the antidote to burnout. It's not an obvious fix, but there are things that we can do, that we can learn. And so I decided to combine those passions and say, how can I go up there and learn what's happening up in Canada and learn what's happening at our university that's well known for its wellness program, and then take that and spread it widely so we can help other people. And so what I went around and did is I interviewed physicians at Stanford, colleagues, mostly people I knew, and I transcribed all the interviews, and we did some qualitative coding where we looked at themes of what are people saying that causes them burnout, causes them wellness, and what are their stories. And then I went up and spent last summer in Vancouver, Canada, in a practice with my colleague, Dr. Dodick, who you met. He's affiliated with the University of British Columbia, but he has a practice in Vancouver and is a clinical physician like myself, a clinician. And he introduced me to his, circle of colleagues that he knows well, and I interviewed them, and then I was going to compare what problems they had that were different, and how they, had this idealized world of medicine. Is it all better? And then, the take-homes were, a lot of things were different when you get down to the details of what caused burnout or what was protective in our two practices, which were very different systems, completely different, healthcare systems, different countries. But at the end of the day, the themes were the same. The lack of control is what causes burnout. Feeling that we're not seen or heard by leadership is what causes burnout. The connections with people and the meaning of our work is the most important part of wellness. And we even had an iceberg on our poster that became very popular, as you might have seen. People were gathering around our iceberg. We called it the wellness iceberg. And at the top of the iceberg were the things that multiple physicians talked to me about when I presented my poster, which is how offensive it is to have someone in management, throw a free pizza down on the break table and pretend that addresses the underlying causes of burnout, which are, really can be devastating, moral injury. They can be such deep, difficult topics that it's offensive, that they would even suggest that resiliency pizza would make such a difference. And so it was those sort of things that are on the top of the iceberg, like free lunch and, whatever, things that a lot of people can't even access, which is one of the themes, is that, wellness programs does not equal wellness. There are barriers to wellness programs, just like social determinants of health for patients. There's determinants of wellness for physicians, because there are things that people can't even access. And we learned how, different challenges for different physicians got into play for wellness. And so under the iceberg was the real theme, which is connections with people is what we need. And that was really a take home. Everyone we talked to, and even some of the physicians in Canada and California, had practiced in Taiwan. They had been to New Zealand. They had other country experience and, visions of what it was like. And it's the same theme everywhere with whatever the administrative burden, whatever the the stress and the things that were making life difficult as a physician. At the end of the day, if you had those fulfilling relationships, right, the meaning with patients, with colleagues, with staff, that sustains you and that protects you.
Are you a doctor struggling to provide the best care for your patients while dealing with financial and caregiving matters out of the scope of your practice? Do you find yourself scrambling to keep up with the latest resources and wish there was an easier way? Then this virtual caregiver conference resource will save you time, money, and sanity by giving you all the resources and information your patients need in one place. This conference helps you and your patients enlist the best strategies around healthcare resources and the best financial steps for your patients while navigating caregiving situations. You don't have to go home feeling frustrated and helpless because you couldn't connect your patients with the best services. Find out more at jeanniedoherty.com or click in the link in the show's notes. You don't want to miss this caregiver resource.
Hi, I'm Rhonda Crow, founder and CEO for MD Coaches. Here on RX for Success, we interview a lot of great medical professionals on how they grew their careers, how they overcame challenges, and how they handle day-to-day work. I really hope you're getting a lot of great information. But if you're looking for an answer to a specific problem, management or administration challenge, or if you're feeling just a bit burnt out, like maybe you chose the wrong career, well, then there's a faster way to get the help you need. No, it's not counseling, it's coaching. RX for Success is produced by MD Coaches, a team of physicians who have been where you are. I know you're used to going it alone, but you don't have to. Get the support you need today. Visit us at mymdcoaches.com to schedule your complimentary consultation. Again, that's mymdcoaches.com, because you're not in this alone.
We'll get back to our interview in just a moment, but right now I want to tell you a little bit about Physician Outlook. If you haven't discovered this remarkable magazine, please do so very soon. It was created by physicians, for physicians, to showcase the intersection between clinical and non-clinical interests. Whether it's writing, painting, cooking, politics, and dozens of other topics, Physician Outlook gives a physician perspective. It's available online and in print. It's really unique among physician lifestyle magazines. And like the Prescription for Success podcast, Physician Outlook amplifies the voice of any physician who has something to say. It also engages patients who still believe in physician-led, team-based care. And Prescription for Success listeners can get 3 months free when you enter our promo code RX for Success and select the monthly option at checkout. That's a really great deal on this stunning publication. And now let's get back to today's interview.
Next, I spoke with Dr. Nikki Cairns, who is a family medicine-focused faculty member at the Oregon Health Sciences University. So also at this conference, I'm with Dr. Nikki Cairns. I attended her breakfast table, roundtable discussion this morning around some of the differences between male and female inbox messaging. It was very eye-opening for me, and it's something that she's really dedicated to around noticing gender differences in terms of healthcare professionals. Am I getting that right?
Yes, absolutely.
Okay.
So my name is Nikki Cairns. I am a family medicine focused faculty member at Oregon Health and Sciences University with the Family Medicine Department, and I have a particular research area of interest in terms of gender when it comes to gendered feedback for residents, as well as gender as it relates to our electronic health record and how those things could be contributing to burnout.
Which is why I wanted interviews, which is great. So you've been thinking about this and studying this, and I'm asking everybody here what they think, especially hospitals, healthcare systems, residency programs, academic departments, all the different sort of organizations that we're involved with. What is top of mind for you right now about what would be helpful for the people who run those things to improve the well-being of physicians?
right? So we know that in general, women physicians receive far more in-basket messages than their male colleagues. We know that women physicians tend to have more female patients, more psychosocial complex patients who are seeking longer and more empathetic listening in their visits. And all of these things result in women with the same amount of FTE doing more work for their patients and for more time, despite having better efficiency metrics in our electronic health record. We're still spending more time because we are getting more things from folks. And so I think it's just first acknowledging that from a systems level and acknowledging that asynchronous work that we're doing, and then allowing for time for that, either if it's blocks in our schedule to be able to do our asynchronous work with our in-baskets, or if it's adjusting panel size based on how much our patient panels are using those services. I think closing our eyes and pretending that it doesn't exist and is resulting in the trend that we're seeing, which is more women burning out in their first 5 years of practice and more women decreasing from full-time FTE going down to part-time, because when they're doing part-time, they're actually doing full-time work.
What I'm hearing you say is raising awareness so people are really aware of this and not rejecting it, not turning a blind eye to it as well.
Yeah, and then doing something about it, right? So
Yes,
either
absolutely.
decreasing those panel sizes or creating those blocks and schedules so that we're actually having time for the work that we're doing.
Yeah. I'm just curious, do you have some thoughts about how to measure whether all those interventions would be effective?
Yeah, absolutely. So a lot of these studies are using something called epic signal data because it tells you how many in-basket messages folks are receiving. It tells you how long they're doing things after work hours. And you can use that data before and after a whole health system does an intervention. So if you see that this particular group of providers has patients who are messaging them 40% more times, you can decrease those providers' patient panels and see, are you factually making a difference? If you really wanted to, you could do before and after burnout surveys to see, are folks having less burnout and less likely to leave your organization? Physicians leaving costs a lot of money for the organization. And so all of those things could be beneficial for the system as well.
Yeah, awesome. Well, this is great. I know we could talk for a long time because I know we both have a lot of ideas about this. But thank you very much for taking the time to connect with me. So thank you, Dr. Nikki Cairns.
Absolutely.
Thank you for joining us on today's episode of Life-Changing Moments. We hope the insights from these physicians at a conference were both inspiring and thought-provoking. In the upcoming episodes, we'll transition from the voices in the trenches to the leaders in the C-suite. We'll be hearing from chief wellness officers from 4 different healthcare systems. These leaders are at the forefront of transforming physician well-being, and I can't wait to dive into their strategies and solutions. I hope you'll join us as we explore what is being done to enhance the professional lives of physicians. You know, your input is crucial in this journey. We'd love to hear your thoughts on what health systems should focus on to support physician well-being. Please visit the SpeakPipe link in our show notes to leave a message with your ideas, experiences, and suggestions. Your contributions might be featured in a future episode, helping us to continue this essential conversation. Remember, your voice matters. Together, we can make a positive impact on the well-being of physicians everywhere. Until next time, take care and be well. Thank you for tuning in to Life-Changing Moments. If you enjoyed this episode, please be sure to rate us 5 stars and leave a review. Doing so helps our podcast reach more listeners. Have something to share? We'd love to hear your thoughts. Visit the MD Coaches community on Facebook groups. This dynamic virtual space is a place to continue discussion about life-changing moments and perhaps share some life-changing moments of your own. Join the conversation today.